Hi friends, this is Dr. Ravi Kamapalli. I'm an infectious disease, wound care, and obesity medicine board certified physician working out of LaGrange, Georgia, and Newnan area in southern Atlanta region, and also Augusta, Georgia. I'm trying to record this video for the occasion of World Obesity Day. I'm an infectious disease doctor, but I do think that infections, wounds, have an underlying metabolic etiology as a root cause. And I'm trying to see if I can educate and convey this message to the people who will be viewing this video. My conflicts are none but removing barriers to healing, to infections, wounds, and obesity. And I do use telemedicine technology in that. I happen to be a small investor in a telemedicine company too, but that's not the point of discussion today. So, what is obesity medicine? It's a field of medicine that is dedicated for comprehensive care of obesity, and WHO has defined obesity as an excessive accumulation of fat that presents risks to the health. So, it's a science-based approach to obesity treatment that is promoted, and as we all know, there is increased rate of obesity with one third of adults either being overweight and also suffering from a lot of problems with diabetes as a consequences of that. And it is been defined by AMA in 2013 as a chronic disease. People who are obesity medicine physicians are being trained now, and there is a certification exam that they take, and there is a lot of new obesity physicians that are getting certified in this field. Now, mostly is to simply define it, it's an excess fat mass disease, simply worded. But we have to understand that BMI, though it is not a good calculation, we need to look at BMI as a quick identifier of this problem. With people having a BMI, a body mass index of less than 18 as underweight, people with 18 to 24 are as healthy weight, and more than 25 to 29 as overweight, and 30 to 34.9 as class 1 obesity, 35 to 39.9 as severely obese class 2, but morbid obesity is more than 40 to 49. And of course, the class 4 obesity is super obesity. So basically, the reason for this discussion today is this week of Obesity Care Week from March 1st to 7th of 2020. And on this occasion, we decided to see if we can discuss further about obesity and highlight this as a real problem at the root of most of the chronic diseases, and including obviously the pandemic of COVID-19 infections that are going on in the community right now. 93 million Americans are affected by obesity, and people with obesity have faced many weight barriers, including biases, and obviously, most physicians are not comfortable because of lack of training of this problem. Now, the roots of obesity run deep, and that is what we have to address and understand that without having a good communication strategy, we will not be able to fight this real pandemic of obesity. 93 million Americans are suffering with this. And like we said, AMA in 2013 said that it's a complex chronic disease causing entity and costing around $427 billion. And nearly 50% are estimated to be becoming obese by 2030. And the people who are affected with obesity are around, as the age goes up, it increases, and it's maybe around 40% easily to average out. And people with obesity pay a lot more for their health care, almost 42%. And it is costing around 61. Estimated cost for Medicare itself is costing around $61.8 billion. And obesity is associated with more than 200 diseases, with mostly stroke, diabetes, cancer, and sleep apnea being one of the major things. So we'll discuss about this and also look at the root cause of metabolic syndrome. We discussed in detail about this in another video done in the past, but quickly, it is a cluster of 5 conditions, with 3 of the 5, if accumulated together, would be called as metabolic syndrome. In people with waist circumference more than 40 inches for men and 35 inches for women, and HDL more than 40 for men and 50 for women, and triglycerides more than 150 milligrams per deciliter. These are fasting blood works. And obviously, blood pressure more than 130 over 85, and blood glucose fasting over 100. Now, all this is because of a condition at the root of this problem called insulin resistance. Now, what is insulin resistance? Is nothing but people producing insulin and their body not responding to it. And that is easily, quickly defined. But when people see high blood sugar elevation or blood pressure, obviously there is insulin resistance and fat mass disease at the root of that problem. Now, metabolic syndrome is associated with insulin resistance, which has high insulin levels. So, these high insulin levels could be individualized, but normally we would expect these insulin levels to be less than in single digits, and mostly nowadays these insulin levels are in the double digits, and some people it's a lot higher in triple digits too. So, metabolic syndrome is associated with glucose intolerance, overweight, high blood pressure, and harmful small dense LDL particles, and low HDL cholesterol, and high triglycerides, and increasing blood clotting factors. So these are multiple conditions like we discussed about in as a cause of insulin resistance, leading to cancers, fatty liver, PCOS, migraine, stroke, dementia, and other multiple different organs in the body are completely affected because of this, with stroke, joint problems, osteoarthritis, GERD, and kidney issues, PCOS, high triglycerides, hypertension, and all these are associated, like most of these are associated with 3 out of 4 chronic diseases of diabetes, heart disease, and cancer and stroke account for almost 75% of costs because of chronic disease costs, and with the healthcare suffering under this burden. So we cannot be letting this continue to happen, and we got to fight it. Now, people, the US population, if it's a 240 million people, and metabolic syndrome is a dysfunction that is affecting a lot of these people. And obviously, if you see, normal weight people are 168 million, and obese people are around 72 million. So normal weight people are 70%, but in the obese patients of 30%, they are 80% of the 30% are sick with obesity, whereas even normal weight people have a metabolic dysfunction. So in total, 57 million of obese people and 67 million of normal weight people are metabolically sick. That is, they have metabolic dysfunction. So this was amazingly pointed out by Dr. Robert Lustig, who is one of the uh, pioneers in this field. And basically, we are to understand that just because one is not obese does not mean they are metabolically good. So, hyperinsulinemia syndrome, we look at sometimes as being diabetes and metabolic obesity, but in reality, it's an iceberg effect. There's a lot of other problems that we talked about earlier, including autoimmunes, multiple sclerosis, depression, and hypertension. Central obesity is one of the major things. And obviously, we need to do a root cause thinking to understand that without effectively understanding what food is doing to our problems, and understanding that the root of all this is insulin resistance in the liver and muscle, and we have to stop fertilizing with bad foods so that we can prevent all these cancers, dementia, prediabetes, and diabetic complications. So also, finally, we need to quickly discuss about this medical weight management facts. On this World Obesity Day, we have to understand that these facts are very important. We need to have an understanding that um, there is options that are available for excess weight, and there is proven results with now services that are being delivered with dietitian based or web based programs, and there's overall lifestyle modifications that could be done, like if we have 5 to 10% weight loss, um, then there is improvement in overall clinical condition of a person. And these programs could be self-directed, and this is mostly lifestyle management, not a particular dietary lifestyle, but a wholesome method wherein fat mass is assessed and then handheld through this through a real program management. And these, and also there is medications that could be given to pull people across to improve their satiety too. So with these medications, sometimes there are new medications that are available that will help weight loss even up to 15%. So, like we said, the fact too we have to understand is has to do with uh, chronic diseases. Like 32% of US adults have hypertension. So even a 10-pound weight loss, consistently keeping it under, will overall improve the hypertension. And also in people with diabetes, so almost 9.4% of Americans are diabetic. That is almost with a lot more having pre-diabetes, with say 80 84 million people have with pre-diabetes, which is very, very, it takes almost 10 years for diabetes to be detected if we don't understand about pre-diabetes. So if we test for fasting insulin levels and the waist circumference or metabolic syndrome criteria 3 out of 5, then we will hedge and try, we can prevent it. So basically programs like diabetes prevention program that are now being able to be delivered with the CDC mandate, and even with telemedicine based solutions that are coming out, would be a huge hit with the with prevention of this chronic diseases. And obviously we need to understand the other problems, including sleep apnea, uh, and improving the uh, weight also improves the chronic diseases on the people, with inflammation improving, like, and osteoarthritis also improves remarkably if we can really work on this. So the third fact is, there is who are obesity physicians. Obesity physicians are now getting certified with American Board of Obesity Medicine, and also Obesity Medicine Association, which is coordinating this extensively. And there is multiple other groups that are working towards physician certification. And what is the role of these physicians is to help handhold the people for healthy lifestyle, teach them what the people should do, and understand that there is better options for food, and also increase physical activity, and which is a contributor with a sedentary lifestyle, which, but it's only 20%. 80% of this problem is really nutrition. So what people are eating and how their biomarkers are being monitored, including different lipid profiles and insulin and other markers, inflammatory markers that are need to be coordinated. So the programs have to be established, and of course, the waist size and metabolic syndrome criteria have to be monitored. People fall off the wagon. It's like you cannot give up on your child. You cannot give up on the people who are suffering with this fat mass disease. Obviously, there is other options, including surgical options, that can be pursued also. So, and people with in minorities and middle-aged adults suffer also. Non-Hispanic blacks are mostly affected, with highly, almost 48% of them are obese. Now, it just comes down to the food and the nutrition that they are eating, like all the carbohydrate laced food or the processed food that people eat really is causing the problem in healthcare. And obviously, we have to work towards improvement and reduction of the processed foods, and whole foods should be eaten. But also, there's different techniques, including restricted time eating and improving protein intake, and nutrient dense foods have to be promoted. So obviously, this has to go through a program that could be monitored and guided. So minorities are getting affected, including Asians, wherein they have thin on the outside and fat on the inside status, with them easily manifesting chronic diseases sooner. Now, coming to the fifth fact, it's about cost and health effects of being overweight and obesity are high. Almost 70% of Americans are currently overweight, with 40% having obesity. And this this is a huge problem. With severe obesity, diabetes and hypertension can happen. And also, National Institute of Health has recently said that severity of obesity is leading cause of death from cancer, diabetes, and heart diseases. And basically, the spending because of this obesity related problems has increased almost 29% from 2001 to 2015. Now, the final fact we have to understand is insurance coverage for weight management is not sufficient. Many people are affected by this, and we need specialized care. And this is a huge economic burden, and hopefully, the administrative leadership understands that the programs have to be developed, because almost obesity is costing around $147 billion. Um, and obese patients are really paying almost $1,429 each year in excess when compared to people who don't have obesity. So that said, it's a complex disease process. It is something that leads to wounds and infections. And obviously, I deal with wounds and infections, but that problems cannot be prevented if we don't address in with the nutritional process understanding and hand holding, use people, process, and technology. Hopefully, this helps you to understand that obesity is the real pandemic. And in fact, with COVID, it has become a real syndemic. Thank you for listening, and feel free to reach out to our office at 706-739-7789. And you can also follow with my social media, Twitter at Wound Physician. I'm on LinkedIn also. And as always, looking towards helping and working towards removing barriers to healing. Take care. Have a great day.